first at 11, the government says you should take a close look at your insurance statements. That is because companies are billing for COVID-19 tests that people never ordered in the first place. It happened to an Indianapolis woman who contacted WRTV Investigates' Kara Kenny.
During the public health emergency, Medicare covered the cost of over-the-counter COVID tests like this one. Now bad actors are stealing Medicare numbers and are billing you for tests you never even ordered. Like a hawk, Judy McAvoy always checks her Medicare statements. The Indianapolis woman found strange charges for COVID-19 tests on her husband's account. Did you ever get any tests in the mail?
No, ever, never.
Did you ever take a COVID test?
No.
The first notice came in March, the second came in July.
Then I really got upset, and that's when I called you.
We reviewed her statements and found 4 different labs in Chicago charged Medicare. The McAvoys haven't had to pay anything out of pocket, but Medicare paid $94 for each test, totaling $376. Hundreds of dollars.
Yes.
For these tests that you never even got.
Right.
And that comes out of our tax dollars.
Exactly.
Because we all pay for Medicare.
The bottom line was I knew it was fraud.
All kinds of fraud, mistakes, and abuse cost Medicare an estimated $60 billion each year.
It's a lucrative business.
Nancy Moore is the director of Indiana's Senior Medicare Patrol, a grant-funded project of the U.S. Department of Health and Human Services aimed at preventing healthcare fraud. She explains bad actors buy stolen Medicare numbers on the dark web.
But they were just using the end of this public health emergency to get rid of their test kits. A lot of people like Judy didn't even receive them.
Are you guys getting complaints about this?
We are getting tons of complaints. We have gotten over 100 complaints.
WRTV Investigates did some checking and found the 4 labs on the McAvoy's Medicare statements are located within 5 miles of each other in Chicago, and they registered to do business in the state of Illinois. We contacted all 4 of the labs via phone. 2 of the phone numbers were disconnected. We left messages for the other 2 and have not heard back. WRTV Investigates contacted the Centers for Medicare and Medicaid Services about Judy McAvoy's situation. The agency told us to protect the integrity of the investigative process, CMS doesn't comment on specific cases. While each complaint may not receive an individual response, we do investigate each report. WRTV Investigates connected Judy McAvoy with Senior Medicare Patrol, which regularly reports fraud to CMS.
Read your statements.
Senior Medicare Patrol recommends checking for services, products, and equipment you didn't order or didn't receive. Nancy Moore found charges for urinary catheters on her Medicare statements.
I never received those, but Medicare was billed almost $3,000. And I don't use that product. And so I called and got a new Medicare number.
Judy McAvoy says she also reported the lab charges to Medicare and plans to request a new Medicare number for her husband.
It's just frustrating, yes, frustrating and, well, angry. Because I know there's so much fraud going on.
If you receive items you did not order, including COVID-19 tests, call 1-800-MEDICARE. That's also the same number to call if you need to request a new Medicare number. Kara Kenny, WRTV.
Now that the COVID public health emergency has officially ended, Medicare and other insurance plans have stopped paying for many over-the-counter COVID tests, which means companies could end up billing you directly. The Federal Trade Commission says it's another reason you need to check your insurance statements, even if you're not on Medicare.
We're very concerned about people's personal information out there. And we want people to know that if they get these test kits, if they get other merchandise that they did not order, by law, they don't have to pay for it.
You can report fraud directly to the Federal Trade Commission. You can find contact information in this story at WRTV.com.